I was asked to find something of interest in my career, and I've spent at least a life sentence in Conton Vale. I should probably clarify that, as a forensic psychiatrist who work in prisons, and I worked on and off for almost 18 years as a prison psychiatrist here. I started off wanting to do learning disability psychiatry because my elder sister had learning difficulties and I was interested, but when I qualified there were no jobs, so I had to look for something else, and they advertised forensic psychiatry, and I thought, is that talking to dead bodies? What's all that about? It transpired it was about mentally disordered offenders, working with the courts and the police and the prisons, and I thought, human interest, that's my thing, I'm quite interested in all that. So I applied and I've been working in it ever since. I've been in quite varied situations which have been a bit risky. One of my outpatients threw a bookcase through the first floor window. I had to ask another outpatient not to bring his machete because I could see it in the sleeve of his anorak. And more recently I've had to deal with a stalker, and I'm going through the courts in relation to that just now, and that's been quite difficult. I think the state hospital sounds more scary for people than it is. It's actually the safest forensic environment because there's a fence and there's no drugs and alcohol and there's no weapons and there's no victims, and people get their medication. So the community is the same people who have transitioned out to the community. That's where the risk is really, and that's where I work, but I enjoy it. I'd like to think at a personal level I've achieved quite a bit, and particularly proud of setting up the Forensic Community Mental Health Service, as we were the first in Scotland. And I think I've contributed my small part to improve patient care along the way. I think I've been fortunate in forensic. We have people in our books for a long time, and so I've actually seen my patients actually bloom and grow and achieve, and that's really quite heartening to be part of that journey. There's been a lot of changes in the health service, but I'm someone who likes change. I get a bit bored with the status quo, so the challenge to improve quality and to make things more efficient and effective is good, and I see things as a glass half full, so I always see things as an opportunity, and try and be part of the solution to all of that.